Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. You know, we have this program every Saturday at the same time, and I hope you're a regular listener. But if perhaps you're new to town, I will invite you to become a regular listener because we have so many wonderful conversations with community members, with our own staff members, with different events that are going on, and just the ever-present, gee, I didn't know that, or what would you like to know about? So today we're going to do something that we haven't done before because we haven't had this opportunity until recently. We have two nurse practitioners married to each other who've been with us a little bit more than a month, coming up to 2.
Yep.
And they are still smiling, happy folks. They've never done a radio show, so this will be interesting if I have to prompt them, which I doubt I will. They're great educators. And so I'd like to present Stephen Maynard and his wife, Suzette Maynard.
Hello. Thank you.
Yeah.
Thank you.
Yeah, thanks for having us.
Well, you know, you came to us as folks that had a lot of history outside of Florida. And you told us that you had originally started as nurses together.
Yeah.
So bring us up to date. Who's the romance person in this? Would that be Suzette, perchance?
Yeah, probably. So I think, we started back on this nursing journey when we first got married, actually, which will
really soon after we got married.
Yeah, it was within like the first 6 months, I think, after nursing. So we both have previous degrees. I have a degree in zoology, a bachelor's, and then I have a master's in biology. And I was working at Cincinnati Children's when we got married, doing research.
Okay.
And you were?
Yeah, I was doing sales. I have a degree in public relations. And I was actually a freight broker of all things. And we didn't really love what we were doing.
No,
right?
we hated it. Yeah. We actually hated it.
So you had that in common off the bat.
Right off the bat,
we just didn't like our...
We didn't like that. And so we decided, I came home one day and, since I had Children's, I was around nursing.
Right.
And I told Steven, I said, I think I want to go back to school for nursing. And he was supportive of it. And he said, I think that's great. And then what?
Yes, it was interesting. We were kind of in talking about this. Like, I remember she told me, and I was kind of in the back of my mind, almost a little jealous. Like I want to do something different. Like, I don't like what I'm doing either.
Yeah.
And I had some exposure to nursing because I worked in an ER through college.
Okay.
So I worked weekends. I did, registration in the emergency department, and I always thought that was kind of a neat thing, like being
helping
around all
others.
those. Yeah, and helping others and seeing nurses do what they do. But I was so far along that I wasn't about to make a big change like that.
Yeah, you don't want to tell your parents.
That
I'm going to add like 3 more years on to college at this point.
I think I'm going to keep college going.
Forever and ever.
Yeah, we got to grow up at some point.
Yeah, so...
Plus, we wanted to get married.
So and then things came up, things kind of presented themselves for me to be able to go, and I told Suzette, I was like, I think I'm going to do this too. And so it was...
So first you got your nursing degrees?
Right, so first we got our nursing degrees, and then
you decided to go on.
We did, we decided to go on, and we were fortunate. We went to Otterbein College, which is in Columbus, Ohio, Westerville area, and they were phenomenal. It was a small program together with the university there, and they fortunately they let Stephen double up on classes, and so he was able to double up on classes because I had
remediation or something.
I had started earlier.
Okay.
I was a semester ahead.
Okay.
Correct.
And then so they let him double up because they thought we could study together then and we could work together then, and so
I have to ask, what made you decide then, when you had already previous degrees and you were already in nursing, what advantages did you see in becoming a nurse practitioner?
I think for me, it was the fact that I really wanted to be on the other side of the bed. And I wanted to really take care of patients and really be the one that was, studying the patient, putting the orders in for the patient, really looking at that patient and trying to fix what the problem was. Being a nurse is so valuable and so important. But for me, I wanted to study, okay, what is their problem? Why is that? Why is their cholesterol elevated? And I really wanted to look back into that and hone in on that. So for me, that's kind of where I was like, okay, if I'm going to do something, I am always going to try my very best at
you're
everything.
Definitely type A.
Yeah, I'm definitely. So I was like, you know what? I want to just further go on with this, and I really want to be on that other side of it.
So besides gaining a study buddy, what was your motivation?
Yeah,
Stuart?
and I would say both of us had the experience of being emergency room nurses, which I think to this day we are incredibly proud of.
Yes,
like
yes.
Maybe I'm more proud of that than even being a nurse practitioner in some way, in some weird ways. That's really stuck with me. But through that experience, I think we both saw problems in the healthcare system, and being a nurse practitioner felt like a solution to some of those problems. Like, how do we prevent some of these people from having to come to the emergency room for their things? And even as a nurse in general, I mean, I worked on an oncology floor as well. And you worked on some ICU step down floors. And so we saw problems that you look at these people and you think, it didn't have to get to this point for you. And how do we prevent these things from occurring in your life? And how do we help people live healthier, fuller lives? And I think being a nurse practitioner that was the answer to helping me figure out a way to solve these problems that other people have.
So did you ever consider returning to medical school as a physician?
No, I love being a nurse practitioner. I don't ever want to change. I don't ever want to go back to medical school. I don't want to do any of that. We did get our doctoral degrees in nursing.
Yeah.
So
what prompted that?
What prompted that was I wanted to also pay it forward. So we teach on the side with Northern Kentucky University nurse practitioner students. And so I feel like it's really important as a nurse practitioner to provide others who want to be a nurse practitioner with that education and to be, pay it forward. So somebody was there to teach me. So I felt like it's important for me to teach somebody else. And, I love being a nurse practitioner. I love what I do. I love taking care of patients. And so for me, it was pretty easy to be able to teach what I love to help other people learn to hopefully love it like we love it. And we had awesome teachers in our career education. And I think that really helped mold us from the time we started as like an RN through the whole program.
I agree. I mean, even in our RNs were actually associate degrees, right? So they weren't, we got them at technical colleges. We don't have our bachelor's in nursing. And I think that's a good thing that people get that. But for us, it just wasn't our journey. And the teachers that we had in our associate's degree program, I mean, some of the things that I'm still like, it's still just ingrained in me, the things that I was taught and how to care for people and what being a nurse is all about. And really, even being a nurse practitioner, you are a nurse first, and all the things that people love and respect about nurses, I think I don't want to lose any of that. So to answer the medical school thing, like, not that doctors don't do a lot of that as well. They do. So I'm not trying to,
No.
But I think the core like part of nursing, like I never wanted to give that up.
You're right. Never want to give that up.
Well, the reality is nurses by training are supposed to be educators. Okay. Doctors are more about anatomy and physiology and how different systems interact and how they can use technology as life goes on in their medical careers. But to the core, nurses are educators. And so I can certainly understand that. We're going to take a very short break for a word from our sponsors. And when we come back, we're going to explore this a little bit more. Okay?
Sounds good.
Thanks.
Yeah.
Great.
Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Sunshine Furniture brightens up your day.
Summer is here, and it's a great time to create your outdoor room at Sunshine Furniture. Right now, during our July clearance sale, you can save up to 50% on all in-stock patio furniture from Lloyd Flanders, Woodard, Windward, Beechcraft, Pollywood, Berlin Gardens, and more. At Sunshine Furniture, we're the outdoor furniture experts and have any style that you need, all built to withstand the Florida elements, and we specialize in replacement cushions, umbrellas, outdoor rugs, and fire pits. Come in now for our July sale, including 50% off all pictures, lamps, and accessories. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Family owned and operated since 1991. Don't forget to visit our outlet and sales store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Ooh, have a sunshine day. Sunshine.
People living with Alzheimer's or dementia can truly thrive at Certus Premier Memory Care Living. Certus provides a cutting-edge, research-based approach to memory care that treats the whole person, not just the symptoms of their memory illness. At Certus, our whole-person approach to care helps bring more joy to their days and create wonderful new memories. Come take a tour. Certus at Vero Beach is at US 1 and 53rd Street. Certus Premier Memory Care Living, where every moment matters.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and happy to say that we serve over 28,000 unduplicated individuals in our community each year. So I want to thank the whole community for the confidence that you show in the services that we provide. We are constantly adding to our staff, not because of turnover, but because by word of mouth, people continue to tell others about the fine services we have. And it's more than just a convenience factor, although certainly access and affordability and the social supports of transportation and language and that are certainly important to us and to our patients. But it's also about the quality of the staff that we have. We hire for their skills, but above that, we hire for the kinds of people that we bring on to be with you. And so today, I'm thrilled to be able to offer up a conversation. They probably feel like they're being interviewed because they haven't been with us for very long, a couple of months. But they are experienced nurse practitioners, Stephen and Suzette Maynard. Yes, they are married. Yep. And we've been talking about their journey from meeting each other and getting married and then deciding that both of them want to change their career path. Even though they had degrees and experience working, they both decided to pursue nursing and then fell so much in love with it that they've gone on to get their nurse practitioner. So they're sort of my, let me ask you all the questions I've always been wanting to ask that I've heard other people ask. And of course, there's the constant comparison now because it is a fairly new field within the last 15 to 20 years. Those of us that grew up earlier in the century, last century, will say, well, what's the difference, and why should I settle for just a nurse practitioner? That sounds like a glorified nurse. And so part of today, I think, is sort of dispelling those rumors, those assumptions, perhaps. So why don't you tell us a little bit about the classes that you took as a nurse practitioner? How did you switch, as you said, Suzette, from one side of the bed to the other, from being a nurse and taking care of people and educating and comforting them to being more of a decision maker and advisor?
Okay. So, we both were nurses. To be a nurse practitioner, you have to be a registered nurse to start with.
Okay.
So you have to be a registered nurse and you have to have bedside experience before you are even considered for a program. in nursing, and you have to have so many years of that experience.
Okay, and certainly being an ER nurse or an OR nurse doesn't hurt, right?
No.
Correct. No, being an ER nurse definitely is helpful for that.
Yeah, it's definitely helped.
And so that's the first step that you take to becoming a nurse practitioner. And so we were nurses in the ER and nurses in ICU step down, and Stephen was also in oncology and ER first. And then we applied into be a nurse practitioner program. That application, we went through the whole application. We had an interview process. Went through the whole thing. And then once you're accepted into it, then you are accepted into their program. The program consists of all types of classes.
It's a couple years of really intensive clinical things. So we have, pharmacology and pathophysiology. And then, I feel like a good bulk of a year was just kind of a breakdown of, they kind of did it at Otterbein. They did it by systems. So you would have, a semester where you did women's health stuff and you did, and you did all these things. And then during
real focused concentrations.
Very focused. Yes. Very focused.
And so there we really focused on, you have a broader pharmacology class, right? That you get bits and pieces of everything. And then you have these other courses that really hammer in, like, this is what it would look like in practice. This is what you do. And during that time, we're doing clinical rotations as well.
All while you're working, too, as a nurse. So there's the key there.
You to forget those skill sets.
No,
you can integrate what you're seeing then with what you're learning.
Correct.
And take that back then to class for
and
more learning.
A lot of your experiences that you build on are from your nursing experience, right? So you gain so much knowledge from just taking care of patients as a nurse, right? You're reading orders, you're seeing what happens once we give these medicines, right? So in essence, especially, and depending on the setting that you're going to work as a nurse practitioner, but I would say for us, the ER, that was a clinical in and of itself, right? So just working down there was a clinical.
So it was working down there full time, and then at night we were in classes on campus doing that. Days off, then we were in clinical because we had to have 500 hours?
600.
600 hours of actual clinicals. So in addition
so folks don't understand that your training is just as rigorous in a different way as going to medical school.
Yes, in a different way.
Yeah,
I like to call it the dark years of my life because that's what we call it, because I really don't remember too much.
See much sunshine?
Right, no much sunshine. Didn't see family much. I spent my time in the ER or I was on campus, or in the library studying, as you know how it is. And then we take boards, so we are board certified. At the end of it all, you have to pass, you have to have certain GPAs throughout the whole program. To keep maintaining in it, and then
if you don't, then you're out.
Then you're out. Correct.
Okay.
So
and we had people that
didn't make it.
I think we had a couple people in our program that ended up kind of dropping out for different reasons, but it's not easy.
Not everybody makes it through it. It's definitely not easy. And then at the end, you take boards, which are national, and so they're time tests. Walk in a room and. Here's the computer. Here you go.
It's not
Start
open
doing
book.
it. No, not open book. Here's case scenarios of patients and what do you do, and so it's definitely it's challenging. And throughout the whole program, we had clinical classes too, where our clinical classes on campus were. Stephen was my patient, or you may be my patient, random patient for the day, and you come in and. What's wrong with her, or figure out what she needs.
Yeah. Sort of like the emergency drills where people pretend to be disaster victims.
Correct. Or I'm actually giving you care as a student, and I'm actually figuring out what's wrong with you. So it definitely was not easy. It was challenging, but I loved it, and I think,
it sounds very similar to what physicians are doing.
Yeah, it's very similar. The difference,
I think the major difference is the amount of clinical hours that, obviously with residencies and things like that, a nurse practitioner doesn't have near the hours of residency that a physician would.
Right. But remind us, the whole purpose is prevention, early detection, managing what they've got now. And so if someone came in and they were physically, we used to call them in the ER a train wreck, okay?
Yes.
Where they hadn't had any care given to them for quite a long time. So multiple systems were involved. What would you do?
So I think, from our perspective as a nurse practitioner, and what we're trained to do is to look at that picture, try to identify problems. If it's something that we're trained in and something that we can address, most definitely we do. But some things are, higher level of care, and that's why there's specialists out there. That's why we have specialists. So if it's something that, we feel like we're not comfortable with, or if it's something where we've tried treatment and, there's guidelines for treatment that we follow just like, the physician would follow. And if, we fail treatment with that, then we refer to a higher level of care, which would be a specialist or, the physician.
So I want to reassure people that the protocols that you follow are the same as a physician's.
Correct.
In terms of the actual treatment and the decision making, that this needs a specialist. I went to a fine physician, but had some cardiology issues last year. So off I went to the specialist, and back I've come to my physician.
And I think
you all work it the same way.
Correct. And I think a lot of what nurse practitioners do, and physicians and physician's assistants, all three really do a lot of the same thing, in that we follow guidelines that have been set, that have been, evidence-based, set by evidence, right? That we let the evidence kind of guide how we practice. And as long as you're following the evidence, well, then, that's what we're going to do as nurse practitioners. That's what we're trained to do, right? A lot of us, once you start to get outside of those boundaries, that may be needed in some cases, but often that requires a specialist to, they've had the experience to know, hey, if this doesn't work, maybe we ought to try this. Whereas, when you're, and especially in primary care, I think a lot of the times you really need to stick to guidelines, because you don't have the experience of seeing all the one-off cases that a specialist gets to see.
Right.
And if you got to see them, you might be able to do that stuff, but you don't always get to see them. So.
Right. And I think a lot of our training too is, identifying those red flags and identifying what is needed at this for this patient, and is this patient the complexity? Is it something that which is in your comfort zone and that you're trained in, or do we need to pull from a specialist and see what and then collaborating with that specialist?
Exactly. Those conversations.
And I think you want a provider that's going to be able to have enough self-awareness to go, hey, this is a little out of my comfort zone. Let's get you to somebody that it's going to be in their wheelhouse, right? Well,
I have to say, you guys came to us with 7 years of ARNP, APRN, I don't know. Your titles keep changing.
Well, they change everywhere for some reason. So.
Well, as nurse practitioners, we're thrilled to have you here. I know I've already gotten a lot of very positive comments.
Okay. We love it here.
We hope that you stay a very, very, very long time. Yep. No more career changes.
No more. No
I think we're done with that.
We're done with that. We're too old.
Definitely done with the career changes.
Too old for career changes. Yes.
So happy you're here.
Yep.
Thank you.
All I can say.
We're happy.
Yeah,
we love it.
Thrilled to be here.
So you are both taking new patients. You're at our
787 building.
Okay.
Yep. And I'm at the Gifford location.
And with your special skill set, we've already farmed you out a little bit to see folks at the jail.
That's right.
And we're hopeful that as they get discharged, they'll know that they have a steady hand to guide them through whatever health issues they might have on the outside.
Yeah.
So thank you both for all you do, and thank you all for being with us today. Next week, we'll have another non-staff visit for another interesting conversation. So I hope you join us then. And have a great evening. Thank you.